Suhasini there? Yeah, please.
Good morning, madams. Myself, Dr. Suhasini from SV Medical College, Tirupati, and today my paper presentation is on sebaceous gland carcinoma of an eyelid lesion, a case report. Introduction. Sebaceous gland carcinoma of the eyelid is a rare tumor and is the third most common tumor after basal cell carcinoma and squamous cell carcinoma. It represents 1 to 1.5% of the eyelid malignancies and usually affects elderly women characterized by high rate of local recurrence, regional and distant metastasis. Usually originate from meibomian glands, glands of Zeiss, sebaceous glands of the carbuncle, eyebrows and periocular skin. Diagnosis is delayed because of its ability to masquerade as benign conditions such as chalagion, blepharitis and less aggressive benign tumors. Surgical excision of the tumor with a 3 mm clear margin followed by lid reconstruction gives both surgical and cosmetic acceptance to the patient. Coming to our case report, our aim is to evaluate the right upper lid swelling of a patient attending to a tertiary care center. Approach to a case of lid swelling, histopathological examination followed by lid reconstruction, followed by surgery with both anatomical and functional restoration of the eyelid. Case discussion. A female patient of age 73 years presented with chief complaints of swelling of right upper lid since 6 months, which was painless and progressive in size. And on examination, a swelling of size 4 into 3 centimeters noted in the center of the right upper lid. On eversion of upper lid, there is conjunctival infiltration with a pegytoid type of spread seen with extension up to 3 mm below the upper end of the tarsal plate. Swelling showed multiple nodularity with ill-defined borders and firm in consistency. Lid margin showed loss of hair and thickening of the lid margin. Patient underwent a tumor excision with lid reconstruction by lateral conthectomy, posterior lamellar graft by posterior tarsal graft from the upper eyelid of the other eye, and anterior lamellae by tensile semicircular rotational flap. Post-operative follow-up was done at 1 week and 1 month. Histopathology showed a well-differentiated sebaceous gland carcinoma. Our conclusion is early diagnosis and treatment of malignant tumors may reduce the morbidity and mortality of the patient. Results: lid reconstruction surgery gives both functional and cosmetic acceptance to the patient. These are the pictures showing 1, 2, 3 pictures showing pre-operative lesion swelling of the patient. And fifth picture is the biopsy excised part of the lid. 6, 7, 8 are the post-operative photographs, and this is post-operative 1 month post-operative photograph and histopathological figures of the patient. And histopathology showing foamy cytoplasm, basaloid cells with mitotic figures and areas of necrosis. Thank you.
Hi Suhasini. So, what was the reconstruction method used here?
Madam, lateral canthotomy was done, followed by posterior lamellar graft was taken from the upper eyelid of other eye, followed by semicircular rotational flap was done to the same upper eyelid.
Anterior lamellar,
yes,
tensils
yes,
flap.
Tensils flap.
Okay, so are you aware of what is pagetoid spread for a SCC?
Pagetoid spread is an epithelial spread which spreads around the epithelium. Like here also, the spread was through the conjunctival invasion, conjunctival epithelial invasion. The mode of spread is around the epithelium.
Okay. Okay, and so for pagetoid spread, did you do a map biopsy in this case?
No, madam, it's not available at our center.
Okay.
We done direct total excision and followed by sent to HPA examination, which turned out to be a sebaceous gland carcinoma.
Okay.
And 1 month follow-up, the patient is doing good with a good anatomical and structural reconstruction of the lid.
Okay. So as in you presented well, your presentation skills are good. Only one suggestion: look into the way you presented the photos.
Yes,
you can make it like the magnified it in a better way. So so many photographs in one. Rather than that, you can make it bigger, and each photograph you can include as a different slide.
Okay, ma'am.
Okay, so today when the other presenters present, look at their presentation and try to pick up how to make the slides better.
Yes, ma'am. Thank you.
Okay, thank you, Suhasini.
What is the margin that you have?
In our case, it is 3 millimeters, ma'am.
Okay.